Hello everyone, welcome to my channel. Today I'm going to talk about lichen planus, which is a white lesion in oral pathology. So what do we observe in lichen planus? We can see white kind of lesions that can be present on the buccal mucosa, that can be present on the tongue. So I'll give a little introduction first, then I'll go into details about the types of the lichen planus, then about how does it look in clinical aspect as well as according to the histology, and what are the differential diagnosis. Okay, so let me write it down. Now, lichen planus is a chronic T-cell mediated inflammatory autoimmune disease. Now, let me just draw a diagram so that you guys can remember it in a funny way. So why did I write this is actually because this disease is an autoimmune disease. So what happens over here is the T lymphocytes will actually destroy and attack the basal cells. Okay, so that is the reason this is called as autoimmune disease. So it is a T cell mediated inflammatory autoimmune disease. Okay, then there are types of lichen planus. Now, let me tell you something. Lichen planus can be seen in cutaneous as well as in the oral form. Like on skin, it can be seen as some spores, where the skin will be very much itchy. And whereas in oral, there are some types. So I'll be talking about it in detail. But in the oral types, they are atrophic form and reticular form and erosive form, plaque type, as well as bullous type. Bullous means like fluid filled type. Okay. Now, reticular type and erosive type are the most common forms orally. Okay. Now, what do we see in reticular type is like if this is the tongue, right? Over here on the like you can see some lesions. You can see it on near the tongue. So there will be white papules that form networks of lines, and they are called as Wickham striae. So you can see white papules connect and form network of lines. They are called as Wickham striae. This is very important because this is characteristic of reticular form of lichen planus. Now we know that leukoplakia is also a white lesion. So how do you differentiate if you get a question on if you have a picture of this tongue and then associated, you see in the buccal mucosa, you see some striations, white striations, which are like forming network. Then what will we say? Is it leukoplakia or is it lichen planus? It will be definitely lichen planus, which is reticular form, because this Wickham striae is specific only to this form of lichen planus. Okay. In the reticular type, this is the main feature. All right. Now we can also see desquamative gingivitis. Okay. What happens over here is, let me show you on the diagram. The gingiva will be inflamed and will be red inside. All right. But let me tell you something. This desquamative gingivitis, I'll just write here. I'm telling that lichen planus can cause desquamative gingivitis. But this is not restricted only to lichen planus. Desquamative gingivitis can be seen in pemphigoid, can be seen in other diseases. So this can also be seen in lichen planus, but it is not the only you can't say that desquamative gingivitis can only be seen in lichen planus. It can be seen in other diseases also. So that was about reticular type. So what did we learn in the reticular type? White papules connect and form network of lines. They are called as Wickham striae, which is the common sign in reticular form. Okay, and you can also observe desquamative gingivitis. Now coming to atrophic or erythematous. Atrophic or erythematous is symptomatic. Okay, wait. This is symptomatic. You can see burning sensation in this form, which is a common complaint by the patient. Okay, and let me tell you another thing about the reticular form is the lesions are bilateral and symmetrical. So if you see bilateral and symmetrical lesions, then it can be it can come under reticular type of lichen planus. Now we have erosive type or ulcerative type. It is usually, like you can see, in the form of red patches. Okay. Now you can see a pseudomembrane covering this ulcer. So here it is mostly red type and you can see ulcers. Now in plaque, mostly seen in tongue, you can see like in 2 or 3 patches. It will be like white raised plaque, also called as hypertrophic type. And now bullous, I told you it is filled with fluid. So these are the types. Reticular type, the most important thing to remember is Wickham's striae, and bilateral and symmetrical lesions can be seen. Atrophic, symptomatic, where you'll see burning sensation. Erosive is the red type, where you'll see ulcers surrounded by pseudomembrane. Then you'll see plaque or hypertrophic, where you'll see like 1 or 3 lesions. And bullous type is vesicle filled. All right. Now, as I have explained you where all can you see, now we know that it can be commonly found in buccal mucosa. It can be found in buccal mucosa, tongue, and gingiva. All right. So this I have just written. Let me write this over here. This is like atrophic or erythematous, where you can see the burning sensation. All right. I just put this GIF so that you guys will remember it more often. Now, let us continue the topic. So where is it clinically found? It is clinically found in buccal mucosa. I'm just writing it again. Tongue and gingiva. Like I told you, it can be seen on skin also. So if you see it on skin, then it is also called as polygonal pruritic purple papules. So it's 4 P's, polygonal pruritic purple papules. All right. Now, let us talk about histological features. Now, about histological features, what happens in this case exactly is parakeratosis can be seen. Now, what happens is, let me draw a normal and an abnormal. So, there'll be hyperkeratosis, and let me just draw. So what exactly happens is, in normal epithelium, you do not see so much of keratin deposits. Over here, the main difference between normal and the lichen planus histological features is you can see hyperparakeratosis. That is nothing but the thickening of the layer. Next, you see the like sawtooth appearance on the retipex. So let me draw this. Sawtooth retipex. Now here you see lot of inflammatory cells which is not present in normal epithelium, and you see T lymphocytes. Okay. Now what happens exactly is this T lymphocytes will actually cause degeneration of basal cells, basal layer of cells. This is a very important point to remember. That is, what does this T cells do? They cause degeneration of basal layer of cells. So what is happening over here? In the body, the T cells are attacking its own layer. So it's going to make sure that it's going to degrade the basal layer of cells, because of which there will be infiltration of these inflammatory cells into subepithelial and connective tissue. Okay, so this is what you need to remember. Now about diagnosing. So about diagnosing oral lichen planus, one of the important thing I explained is Wickham's tray. All right, so if you see reticular lesions and if it's bilateral and symmetrical, then it is a reticular form of oral lichen planus. But if you see like isolated lesions, then best option is to go for biopsy. Now coming to the treatment, corticosteroids can be used, as well as antifungal therapy can be given. And antifungal therapy is given to remove the candidal colonization, and vitamin A supplements also will be given. So let us have a quick review. All right. So lichen planus is nothing but T cell mediated inflammatory autoimmune disease. And the types are, let me just change the color so that it will be easy when I review, so that you understand more better. So the types are reticular, atrophic, erosive, plaque, and bullous. Now in the reticular, Wickham's tray is very important. You see, you can notice like a network of lines, that is the white papules, which is the main sign in the reticular form, and it is strictly reserved for lichen planus. Okay, and desquamated gingivitis also can be seen in this form, and in atrophic form, the main important thing is there will be burning sensation. In the erosive form, you can see ulcers, which are usually surrounded by striae, and they are surrounded by pseudomembrane, and it will be like red patches. Plaque or hypertrophic type, you can see white raised plaques, and in bullous type, you can see fluid filled. Okay, so one of the way that you can try to differentiate this from that of the leukoplakia is, if you see Wickham's tray, then you know that it is definitely lichen planus. This GIF over here is mainly to show you that atrophic or erythematous is symptomatic, where you can feel a burning sensation in the mouth. Okay, now we know what are the clinical findings and where do you see these lesions. You can see it in buccal mucosa, tongue, and gingiva. And if this lichen planus is present on the skin, then it is a cutaneous lesion. It's also called as polygonal pleuritic purple papules. It can be present in that form. Histological features are, you can see hyperkeratosis, and there'll be band of inflammatory cells over here. And what happens is T cells, T lymphocytes mainly cause destruction of basal cell layer. And what happens is, because of that, the inflammatory contents are going to pass through the subepithelial and connective tissue. And you also see sawtooth shaped retipex. Now, diagnosing OLP, I told you, main thing is Wickham's tray, and to look for if it is bilateral lesions or symmetrical lesions, or you can notice any burning sensation, or there are red patches. And if there are isolated lesions, you should go for biopsy. Okay, let me just add a small few lines on differential diagnosis. So we know that reticular type, main thing is Wickham's tray. All right, and erythematous is burning sensation can be seen, whereas plaque type is where you see like, 2 to 3 lesions. This is like burning sensations, and reticular is Wickham's tray can be seen. So a differential diagnosis for reticular type is lichenoid lesions, and for erythematous, it is pemphigus, pemphigoid, and atrophic candidiasis, lupus erythematosus, and erythroplakia. Okay, and for plaque related, it is leukoplakia. Now, The treatment for this is corticosteroids, antifungal therapies given mainly to remove candidal colonization, and vitamin A supplements are also given. So I hope you have understood and clear about Lichen Planus. In case you guys have any questions, you can always leave a comment below and I would be more than happy to explain in detail. And if you have any questions, you can always leave in the comments below. And if you want me to make any specific video related to dental topics or biology topics, please do let me know. Thanks for watching. And in case you did not subscribe, please subscribe to my channel. And if you liked it, please do share this. Thank you.